Dear friends, welcome to the show Talk with Your Doc. I am Dr. Prashant Jani, and with us is today Dr. Philip George. Dr. Philip George is an intensivist and trained respiratory physician at Thunder Bay Regional Health Science Center. And today we are going to talk about pulmonary embolism. Pulmonary embolism is a leading cause of sudden death. And if we diagnose pulmonary embolism and treat it or take a preventive measure, such sudden death can be prevented. So Dr. Philip George is going to guide us today about what is pulmonary embolism, what are the causes, how to treat it, and what are the complications. Thank you, Dr. George, for coming to the show.
Thanks for inviting me.
Appreciate your time. Please tell us, what is pulmonary embolism?
Pulmonary embolism is basically clot formation in the pulmonary artery, which is a major blood vessel connecting the lungs to the heart. The clot formation in the pulmonary artery can happen anywhere in the body, but specifically in relation to pulmonary embolism, it usually happens in the veins in the leg and in the arms and sometimes in the pelvis, what we call as deep vein thrombosis.
So you mean to say that these arteries which are supplying the blood to the lung, there's a clot formation there, that is what is called pulmonary embolism?
Yes, basically the clot forms in the different areas in the body. It gets into the bloodstream and gets lodged in the lungs, which is what we call as the pulmonary embolism.
Okay.
The formation of clots in the veins in the different parts of the body, we call it deep vein thrombosis.
Okay.
In combination, the pulmonary embolism and deep venous thrombosis, together we can call it venous thromboembolic disease.
Okay. So now when the blood is clotted in other parts of the body, say in the leg, and how does it travel to the lungs?
Through the veins, every blood from all parts of the body, they have to get to the lungs to get purified. So basically it goes to the heart first. The veins, from the veins, because of the pumping action of the different muscles, it gets transported to the heart, especially the right side of the heart. And from the right side of the heart, it gets to the lungs via the pulmonary artery.
So how does a clot, what is a clot? Please tell us first.
A clot is an organized, we call it blood product, or to put it simply, it is a blood products which gets clotted. We call it fibrin as well. I mean, we must remember that the body has its own mechanism for clot formation and to prevent the clot formation too.
So how does a clot is formed within the vein in the leg?
There can be many reasons for that. And one of the common causes is pooling of blood in the veins, or in other words, the blood remains stationary in the vein for a period of time. That can occur in situations like prolonged rest after surgery, people who travel long distances and long haul flights. That is one of the mechanisms by which it can happen. The second common mechanism it happens is when there is injury to the vein. The injury to the vein can occur as a result of fracture, especially the fracture in the long bones of the leg, and also following surgery. Again, it can also happen in association with other diseases like heart failure, atrial fibrillation, and sometimes in heart attacks. One of the other common causes is problem with the clotting factors. As I mentioned before, there are factors in our body which promotes and which prevents clot formation. So either increase in the factors which promote clots or decrease in the factors that prevent clots can cause it. One of the common situations is, say, people who have cancer, certain types of cancer, can have increased clot formation
in the legs.
And again in the veins in the pelvis as well.
Okay.
And also certain drugs, more commonly women who take oral contraceptive pills.
Oral contraceptive pills, they can also cause clot in the legs, and those clot can travel to the lung, causing pulmonary embolism.
Yes.
So what is the relationship of smoking and the clot formation in the leg?
So smoking, the people have looked into it, and smoking is a risk factor for pulmonary embolism. But
so it leads to clot formation in the legs?
Promotes clot formation in different systems of the body and especially the legs, and that is traveled to the vein or to the pulmonary artery in the lungs.
So this clot, because of all this variety of reasons, when it is formed in the leg, the part of that clot get dislodged, which we call it embolus?
Yes.
And then that will travel to the lungs?
Yes.
So then what happens in the lungs when the clot from the leg goes to the lung?
So in the lungs, what happens is there is blockage of blood flow to the lungs.
Okay.
That reduces the amount of oxygen in the lungs. That in turn leads to increased pressure in the pulmonary artery, which in turn leads to heart failure, especially failure to the right side of the heart. So the condition in which there is increased blood pressure in the pulmonary artery, we call it pulmonary hypertension, and heart failure, which results as a reason of, as a result of the increased pressure in the pulmonary artery, we call it right heart failure, or in some occasions copulmonale.
So small clot of blood which travels to the lung can cause sudden death?
Yes, it can. So again, the size of the clot is important, and again the other factors which are important is the rapidity with which the blockage occurs, and also the patient's pre-existing conditions. For example, if patients have pre-existing heart disease, a small clot would have a bigger effect than it would do in a normal person without heart disease.
If somebody has a clot in the leg, what will happen to it? Will he have a pain in the leg, or how will he come to know that there is a clot in the leg?
So the common symptoms are pain and swelling. So pain can be localized, it can happen when people walk around, and mainly swelling. But if the clot is really big, it can cause more symptoms, much more severe symptoms like blockage of circulation to the legs as well.
So which part of the leg you get a swelling, like front part, left part, posteriorly along the thighs or calf?
Usually it's common in the calf muscles.
Calf muscles.
It will be painful to touch as well. And because of the blockage of the blood supply, we tend to get edema or swelling of the whole leg as well.
Along the calf?
Along the calf and also in the front of the leg, and sometimes in the ankles too.
So one leg or both the legs?
It depends. It can happen in one leg, especially if it happens following surgery. It can happen in one leg. But if it is as a result of a generalized cause like a clotting factor problem, it can happen in both legs too.
So that is what we call deep vein thrombosis?
That is what is called deep vein thrombosis.
Okay. Dr. George, we'll take a short break and we'll come back for the next part. Please stay back for the next part. Thank you. Welcome back to the show Talk with Your Doc. I'm Dr. Prashant Jani, and with us is Dr. Philip George, and we are talking about pulmonary embolism. Dr. Philip George, you were talking about a clot in the leg which can cause swelling of the leg, redness of the leg, pain, which is called deep vein thrombosis, right?
Yes.
So the variety of causes you mentioned, immobility, post-operative causes, or oral contraceptive pills, or variety of drugs, or cancer patients can also get this clot in the leg. So how does it get dislodged from the leg?
So because when the clot goes beyond a certain size, part of it breaks off, gets into the bloodstream and gets into the lungs.
Okay.
That is how we get pulmonary embolism. And again, size does matter, but also depends on how strong the clot is.
How big?
How big the clot is, and how even small clots can break off depending on how stable it is.
So once it goes to the lung, does it go to any other part of the body, or it goes just to the lung, or it can go to brain or anywhere else?
Usually just to the lungs, because we need a connection between the right and the left side of the heart.
Okay.
But in some situations where people have what we call as patent foramina varia, where there's a connection between the right and the left side of the heart, it can travel to the arterial circulation, gets into the brain, but usually it goes to the lung.
So when the clot is dislodged from the legs, it is called as embolus.
Yes.
And this embolus, when it goes to the lung, we call pulmonary embolism, right?
Yes.
Now, what happens to the patient, like signs and symptoms wise, when it goes to the lung? What will patient present with?
Yeah, the commonest symptoms are difficulty in breathing, It can happen both when the patient is at rest or when he is walking about. The other symptom of note is sharp chest pain, which again can happen suddenly or can build over time. The chest pain of pulmonary embolism can mimic the pain of a heart attack. And again, it usually, sometimes a patient get a pain when they take a deep breath in, what we call in scientific terms as a pleuritic type of pain. The patients can also experience cough and bring out sputum with or without blood in it. And one of the other features is that they can have their resting heart rate can be high. So because of the stress to the heart tends to go a bit rapidly. Again, some patients present with wheezing, just like asthma. And it is also important to note that sometimes they can have episodes of fainting episodes as well because of the effect of the pulmonary embolism to the heart. Of note, it is very important to note that some patients don't have any symptoms at all.
Asymptomatic.
They are asymptomatic and sometimes are detected when they're in hospital or when something else turns up.
So it can happen all of a sudden, chest pain, breathlessness and pain on the breathing. What should one do then?
Again, it is important to go to the hospital straight
Immediately
away.
you go to the hospital.
Because if the pain is, it's the nature of the pain, again, this pain is out of keeping with what we normally expect. Just as in the case with heart attacks, it's important that you go to the hospital. Again, that is where the risk factors we mentioned earlier comes into play. It's particularly relevant for people who have had prolonged immobility or recent surgery or recent fracture, or who is on chemotherapy for cancer.
So any of those patients, if they get sudden pain in the chest and breathing problem or pain on the breathing, they should go to the doctor.
It is important
Hospital.
to get it checked in the
So
hospital.
what happens, what sort of investigations happen in the hospital to diagnose pulmonary embolism?
Once they get to the hospital, I think the most important thing is a careful history and a physical examination. And again, with specific relevance to pulmonary embolism, on the basis of the history and examination, the doctors, they have some probability criteria. There are different scores they look to see how probable is this symptom a result of pulmonary embolism. And depending on whether it is low probability or high probability, the doctors do order further tests.
So what are the tests ordered by the doctor?
We normally order a blood test called a D-dimer testing. It is basically testing for the products of clot in the blood. And then the definitive investigation of choice to diagnose the pulmonary embolism is what we call as a CT pulmonary angiogram, whereby the radiologist would inject dye into the veins and then take CT pictures of the pulmonary artery to look for any filling defects, as we say, or blockages.
So this pulmonary angiogram will detect where is the clot in the lung?
Yes.
Is it like an invasive procedure, or how does the procedure happen?
It's like a plain CT scan. The only difference is that they'll have to inject some dye in there. So they put in a needle into the vein and inject some dye before taking the scan.
So it's like a CT scan with an injection of a dye.
Exactly, yeah.
Does the patient need anesthesia or anything?
The patient don't usually not. It's just like a CT scan.
So half an hour, 1 hour procedure?
Much less than that. Usually 10 to 15 minutes at the most. Of course, the scan is a bit more complicated than we see it, as there are special programs which a radiologists use to get the sort of images they need.
Do they do any other investigations like to detect the clot in the legs or anywhere else? How does it?
So some people cannot have the dye because the dye cannot affect the function of the kidney. In those situations, sometimes we do another special scan called a VQ scan or a ventilation perfusion scan. Again, that scan is a bit more complicated. It takes a bit more time, whereby they inhale and inject stuff to look for the blood flow and the air flow to different areas of the lung. If that is not possible, it is also advised that we could take a ultrasound venogram or ultrasound of the leg to look for blockages in the leg, because as we mentioned before, majority of the pulmonary embolism, the clot travels to the lungs from the leg veins.
Yeah. Right. So now once the patient is diagnosed after doing all these investigations, then what happens further?
So diagnosis usually happens in the hospital,
Mm-hmm.
and further treatment depends on the clinical condition of the patient. In other words, is the patient okay in terms of the blood pressure and the pulse rate and how they generally are. So that is probably the most important thing when it comes to treatment. Again, if the patient is stable in terms of having a normal blood pressure, normal oxygen levels, normal pulse rate, and if they are feeling well,
Mm-hmm.
they can, sometimes we even send them home with the appropriate medication.
Thank you, Dr. Philip George. We'll take a short break and we'll continue with the last part of the session. Please stay back for the last part. Thank you. Welcome back to the show, Talk with Your Doc. With us is today Dr. Philip George, and we are talking about pulmonary embolism. Dr. George, pulmonary embolism can be really a serious disease, right? Patient can die also.
Yes.
What is the time frame when patient gets symptom and by the time patient comes to hospital? What are the chances he will survive or not?
Again, it all depends on how the patient's condition is at the time. As you've mentioned, it can cause sudden death, and sometimes patients come in with severe low blood pressure and very low oxygen levels in the blood. So it all depends on, again, to an extent, that depends on what the patient's baseline is and for how long the patient's been having the symptoms for, etc.
So how many percentage of patients survive after getting episode?
If they get treatment on time, majority of the patients survive.
Okay.
The 1 year mortality, they say, is approximately 30%.
30%.
Yes.
Yeah. So what are the treatment options available now if somebody is diagnosed with the pulmonary embolism with all the symptoms and investigations?
Yeah. So again, what treatments we do first depends on the condition of the patient. The mainstay of treatment is what we call as oral anticoagulants or blood thinning medication.
Blood thinners.
Blood thinners.
Yeah.
The common blood thinners, it used to be warfarin. Warfarin was the mainstay of treatment.
Yes.
But now there is a group of medication called direct oral anticoagulants or novel oral anticoagulants,
Mm-hmm.
which have come into market in the last 5 years or so. It has been found to be as effective as warfarin and with sort of low side effects, which is mainly bleeding compared to warfarin.
So patient has to take this tablet every day, or how
The
does
patient has to take this tablet every day. I mean, the advantage of this medication is that it acts instantaneously, and again, the absorption and the distribution of the drug is all favorable, that we don't have to do any blood tests as we normally do with warfarin. So
Okay.
the tablet has to be taken daily,
Okay.
and the duration of treatment depends on what has actually caused the episode. In majority of the situations, the duration of treatment is 3 to 6 months.
So these tablets, which you call, what is the name?
It's called novel oral anticoagulants or direct NOACs or DOACs, as they
So
say.
this one will prevent the clot formation in the legs?
It has been sort of, it is in studies they found that it is a useful thing in prevention too, but it has not sort of been recommended yet, as the studies have not just come out and the experts are analyzing it.
So how does it act in your body? Like it prevents the clot formation and hence prevent the embolism?
Yes, it's mainly acts on some of the clotting factors which
Yeah.
promote the clot, and thus prevents further clot from
So now,
accumulating.
if we are taking these oral anticoagulants, if somebody gets injury, will it prevent the clot formation at the site of injury?
Again, the patients can have a bit more bleeding than normal,
Okay,
but with appropriate pressure
right.
and appropriate intervention, the bleeding usually stops.
Is there any side effects of this oral anticoagulant treatments?
The main side effect is excessive bleeding. So people who take the oral anticoagulants have to be careful when it comes to high intensity sports and etc.
Okay.
And again, it is not recommended in patients with renal diseases
Okay.
because it tends to act a bit longer in people who have renal problems.
So those who have this renal problems or any other bleeding disorders, what are the treatment options for them, because they can't take these oral anticoagulants then?
So the good old warfarin is the treatment of choice then. And again, in patients who cannot take warfarin, heparin is another option.
Okay.
We call it low molecular weight heparin, which we can inject under the skin
Right.
twice a day, usually, or once a day, depending on what it is. And again, mainly it's heparin and warfarin.
Is there any compression stockings or anything they are using in the treatment?
Yeah, compression stockings help. It promotes the pumping action in the legs.
So you put it around
And
the
you
leg?
put it around the legs, and that will promote the blood flow through the veins in the leg, just preventing stasis of blood.
Okay.
So again, that has been touted as an intervention in the long term, mainly in the long term prevention of the clots, but you can use it in the short term as well after starting the people on oral anticoagulant medication.
Is there any surgical treatment or any procedures done for the deep vein thrombosis or removing the clot from the lungs or anything?
Yes, I mean, in very severe cases, they have attempted what we call as embolectomy, or removing the clot from the lungs.
Mm-hmm.
But over the period of time, it has been found to be not that beneficial.
Mm-hmm.
But nowadays, they're developing new techniques by which they can get into the lungs and they can get into the veins of the leg through special catheters, whereby they remove the clot directly and also give them clot busting medication, what we call as thrombolytic therapy.
Do we have that here at Thunder Bay Regional?
We don't have it. Again, this is not a widespread thing. It is being tried out in the different trials now.
Mm-hmm.
So, but again, it looks as if that's where things are moving right now.
So now, how can one prevent all these complications? So how do we prevent the clots formation in the leg or deep vein thrombosis, which further leads to embolism? So how do we take the preventive measures?
Again, there are a few things which we could do. Again, regular exercise, avoiding sedentary lifestyle, especially when you're flying long distances or when you know that you're going to be fairly immobile for a while.
In the plane?
For example, in the plane, getting up every hour,
And
stretching,
moving around.
certainly helps.
Yes.
Adequate hydration is another important factor. Again, an avoidance of alcohol and caffeine is also pretty important. We could also try compression stockings when we know that it's going to be fairly, when we're going to be fairly mobile after a while. Again, situations such as surgery and fracture of the legs.
Yeah.
As soon as we go into the hospital, the doctors would tend to start you on anticoagulation. Basically, most of the time, heparin injection under the skin.
So after surgery, one should be mobile as soon as possible.
As soon as possible.
Otherwise, it will lead to clot formation then.
Yes.
How about this oral contraceptive pill? Should we take or should we not take? Or
Again, very few people on oral contraceptive pills develop this. And again, if you have a family history of clot formation, then it's important that you talk to your doctor about the risks and benefits of it. Otherwise, we can go ahead with it, and we have to be aware of the symptoms.
And then smoking, how one should not smoke probably?
Again, that is another important preventive factor.
Yes.
Smoking in general terms promotes clot formation, and it is best avoided.
Yeah.
Especially if there is a family history, and especially if you've had a clot before.
Yeah, such a small measures can prevent a sudden death probably.
Exactly.
It can be seen in young patients also, right?
It can be seen in young patients too.
Yeah.
Hereditary factors play a very minor role, but again, it's predominantly the factors are from immobility. Okay, we tend to see that in people who are in young people, especially after sport injuries, when they're immobile for a certain period of time.
So it's very important to keep a healthy mobile lifestyle.
Yes.
Yes, to prevent sudden death.
Yes, and adequate hydration.
Thank you, Dr. George, for coming today and guiding us on the pulmonary embolism.
Thank you for having me.
Thank you, everyone. Thank you so much.